Good morning, family. It's a pleasure to be in your home today. Today we are going to be talking about COVID management during your stay at home with mild to moderate disease. It is very imperative that you have a medical box at home because once you test positive, you will not be able to leave your home. So we're going to go through a few essentials that should be in your medical box. The first one that's imperative to have is a pulse oximeter. This is an incredibly essential device. It's simple to use. You put it on your finger in the morning and the afternoon, and it monitors the oxygen saturation in your blood. With COVID, patients desaturate. So we would like your oxygen saturation to be above 94%. Between 90 and 94%, we would watch you, but below 90%, it's very crucial that you go to your hospital, because usually a lot of our patients that are not surviving COVID come in with a very low oxygen saturation, and there's really not much else we can do because it's usually later on in the disease process. So this is imperative that you have in your box. You need to just switch it on, put it on your finger, and it will give you a reading. And like I said, above 94 is ideal. The next piece of equipment that you would need is a thermometer. This is to measure your temperature while you are at home. Patients present with a fever during the beginning of the disease. It can go on for a few days, but you need to measure and monitor your temperature. If it's above 37.5, we would be concerned, and I'll go through some meds that you could use later on, but you need to be aware of it, you need to be alert, and you need to be monitoring your temperature. Onto the medication that you need. Panado is definitely the GP's number one choice. You need to take 2 Panados, which will equal 1 gram, every 6 hours during your 10 days of isolation or while you have symptoms. Panado helps with pain, it helps with your fever, it helps with your body fatigue and your headache. Panado is also very important to use because it allows your body to, if you're going to have symptoms, it tries to keep those symptoms at bay, which is very good. So I would suggest you keep a box or 2 in your medical equipment box and you use this as necessary. Please do not use Brufen or any non-steroidal anti-inflammatories because they are contraindicated in COVID. The next one you need is your zinc complex. This is the unsung hero in COVID. It's an antiviral and it works so well. You'd want to take 200 milligrams a day for 5 days or until your symptoms recover or until you recover. You also need to have vitamin C in your box, which is so essential right now. You can take 500 milligrams to 1 gram twice a day, and you take this in the morning and the afternoon. The other one that you would need is your vitamin D, which is 50,000 international units once a week, and you can get that from your pharmacy. All these medications are over the counter. You would need a Baraka, Centrum, Calcivita, something that's a multivitamin. You will suffer from COVID fatigue. COVID fatigue is a real thing. It can proceed for many months after the disease. So you'd want to keep your energy levels up. So one in the morning and 1 in the afternoon would really help with that, with the fatigue and you moving around. The next thing we want to talk about is breathing exercises. Breathing exercises are so essential, and as a patient you need to be doing that whether you have a cough or not. A lot of patients do not do this, and that's how the infection starts and progresses and becomes worse. Breathing exercises exercise your lungs. It allows your lungs to be mobile. It allows you to then move around, and it also allows you to see how severe the disease is, and is it getting better or is it getting worse? And most times you as a patient will have to determine that. So the first exercise that you would need to do is to breathe in deeply through your nose, Hold it for 5 seconds and then breathe out through your mouth and breathe out over a long period of time. You can do this 5 times, and then on the 6th time, you want to cough when you are breathing out. You need to do this as often and as frequently in the day as possible, and you can continue doing this even after your symptoms have resolved. You could use a balloon to also do these exercises. The other important integral thing that you need to know is you need to sleep prone. Sleeping prone means you sleep on your tummy. Patients in the COVID ward only sleep prone because it increases the lung capacity and the ability for the lung to work better. So please do not sleep on your back or your side. Always sleep prone when you are in the bed. Let's talk about your diet. Your diet is essential because that's one of the things that can help you fight COVID. You can try an anti-inflammatory diet, which includes a lot of fish, which are your proteins and your omega, and a lot of leafy vegetables. Please cut down on the takeouts, cool drink, and increase your citrus, your fruit, and your vegetable intake. This will help you increase your energy levels and increase your ability to fight the disease. The other thing that you may encounter is that you will feel very fatigued and lethargic. You will not want to get out of the bed. You will want to rest because the virus is quite debilitating. But you need to go outside. You get vitamin D from sunlight, so it's essential that you go out as frequently as possible. You need to mobilize, walk around in your room if you are isolating in a room, or your house. You need to do daily activities of living, such as having a bath, brushing your teeth, cleaning your bed, cleaning your room, because these activities will help you be mobile, and that's what you want to do. You do not want to lie in the bed and think that rest is going to help you. You need to move around and mobilize. It's imperative. The next thing that you do need to know is, when do you go to the hospital? In this situation, if you have saturation of less than 90, oxygen saturation on your pulse oximeter that's less than 90, please go to your local hospital. They are the environment where you're going to get an x-ray, you're going to be managed further, and they will be able to manage you. If your symptoms are not resolving after 7 days, your symptoms have progressively gotten worse, you have a new fever, so your fever that you initially started off resolved and now you have a new fever, poor concentration, lethargy that is just not getting better, dehydration, anything where you feel like you can't breathe. If you do not have an oxygen saturation, you're breathing quite fast and you feel like it's not enough, that is when you need to get to your hospital. Please do not wait. The earlier you get to the hospital, the better for you, because then we can start treatment and we can start management. The last point that I have is there are many drugs on the market at the moment, or not on the market at the moment, that has been pushed as being a cure for COVID. Please do not try to get these medications without consulting with a medical practitioner. A lot of these medications have not been proven, and you do not want to take something that may not be agreeable with your body and that may have adverse effects. So please do what I've told you. Consult with your doctor, your local hospital, and if you need help, call for help. I have had COVID twice and I have recovered well with doing these simple things at home. A lot of patients are demising because of comorbidities, but if you are young and healthy and follow through with what you need to and be wise about your treatment, you can recover. There is light at the end of this tunnel. So I wish you safety, I wish you good health, and if you need any help, consult your local hospital and your local practitioner. Take care and God bless.